Welcome to Mental Health Talk here at Mathari National Teaching and Referral Hospital. I'm your host, Dr. Simon Jogona. Our guest today is Dr. Jeniffer Njoki, who is a psychiatrist at this hospital. This is a public awareness session where we teach the public on the different aspects of mental illness and mental health. So today we'll be discussing about mental illness, what actually it is, and I'll go straight to ask you the first question, Dr. Jeniffer. When people use this term mental illness, what actually does it mean?
Mental illness, these are medical conditions that affect a person. They affect how they feel, how they think, how they behave, and could also affect their moods. So mental illness, it is not a single disease. There are different types of diseases under mental illness. So we have different examples of mental illnesses, which can range from mood disorders to psychotic disorders.
Let's go to one very specific condition you have mentioned, that there are conditions called psychotic disorders. And what do we mean by the word psychosis?
Okay, yes. So psychosis, it's a common term both in hospital and outside the hospital to the public. So psychosis means it's a loss of touch with reality. So someone is not able to differentiate what is real and what is not real, and it presents with different signs and symptoms. So examples of the main symptoms that a person presents with: one is what we call hallucinations. Another one is called delusions. Another one is a change in behavior, and also a change in the way someone speaks.
Probably you can further explain to the public, what actually do you mean by the word hallucination? What is hallucinations? How can they identify what you call hallucinations?
Okay, in medical terms, we say that hallucinations are perceptions without an external stimuli. So this means that, and hallucinations occur in the five main senses. That is the touch, the smell, the taste, the hearing, and the sight. So a person is able to experience a sensation in any of those senses, but in reality, there is no stimulation. For example, someone can be hearing voices, which is quite common. Someone hears someone speaking to them, but in reality, there is no physical person, so they just hear voices.
So what about delusions? Probably you can explain it to the public. What do we mean by the word delusion?
So a delusion, we say that it's a fixed family-held belief. So this means that an individual believes something and they're convinced that's the truth. And no matter how much you try to explain to them, they cannot. You cannot shake them from what they believe. You cannot change their minds. For example, someone can feel that their neighbor wants to harm them, or someone feels that someone is poisoning their food. And no matter how much you try to convince them, you cannot convince them otherwise. These symptoms also affect how one deals with reality, and also affects how they cope with situations, affects relationships, and even affect their day-to-day activities.
Is it a very common condition, people coming to hospital with what you are referring as psychosis?
Yes, psychosis is very common. We always see people here in the hospital and even in our community. So many people have psychosis, but some of them have not yet been treated.
When you receive these patients with psychosis, is it treatable? What are the outcomes when they go through treatment? Are there different types of psychotic disorders?
Yes, so we have different types of psychotic disorders. We have the ones which range from the mild form to the ones which are quite severe. For example, we have one we call the brief psychotic disorder, which can be severe in the initial phases, but someone recovers within no time. We also have now the ones which are quite severe, what we call schizophrenia. We also have others like psychosis induced by substance use. We also have schizoaffective disorder.
Let me focus on two of these conditions, like the one you mentioned, brief psychotic disorder. Why the term brief?
So brief, we know that brief in English means it takes a short duration. So brief psychotic disorder, we say it's brief because the symptoms last at least between 1 day to 1 month. And after that, someone is able to return to their normal functioning. So unlike other conditions where the symptoms may be there for a long period of time, For brief psychotic disorder, the symptoms are there just between a day to 1 month, and someone is able to return to go back to their normal functioning.
Are there other known risk factors, or actually do alcohol and substance could be one of the risk factors which can contribute to psychotic episode? Could there be others, like even medical conditions, other physiological conditions?
So psychosis has different triggers and different causes. Like for example, as you have said, substance use can induce psychosis. They can lead to psychosis. For example, the common substances we know that cause psychosis is cannabis. We also have other risk factors like acute stress. There are people who, when they go through a lot of very intense acute stress, they develop psychosis. For example, loss of a loved one, loss of a job. We also have some other medical conditions which can cause psychosis. Someone can be having maybe a meningitis or something in the brain. So actually in Mathari, when we come, we always investigate our patients. We just don't say this is a mental health illness. We do a lot of investigations to rule out other things that can cause psychosis.
What message would you tell the public in terms of how can they recognize these people going through psychosis, and how can they help them so that they can seek care? And as we have heard that these are treatable conditions, we can be able to give them the necessary treatment and they get back into their normal functioning.
Okay, yes, so I'll focus a bit on the brief psychotic disorder. So we've said that it's a disorder that it's quite brief, and someone is able to go back to their normal functioning. So this means that it is a treatable mental health condition. So at times outside there we have a lot of stigma and labeling, but this is just any one of us can get those symptoms, and it is treatable. So we encourage many people to come to seek help. If you have a loved one or a friend or a neighbor who has the above symptoms, bring them to hospital. It's treatable. And so we use medication to treat them. And a good number of them, they are able to recover completely. However, some of them might relapse or might have other episodes, but they are treatable. Even the other chronic other disorders of other psychotic disorders like schizophrenia, they take long, but they're still manageable. Patients who are on medication, they have a better life compared to the ones who are left in the community without treatments. So we encourage people to seek treatments, and let's not have a lot of stigma. There's very good outcome with treatments. We appreciate that we come from communities. We appreciate that by nature we are people who are religious, but we also appreciate the fact that there is evidence in science. So evidence has shown that mental illnesses, they are illnesses. They're not because at times people say that someone is bewitched, or maybe their family, they have not paid dowry, they have not paid something. But science has shown that mental illnesses, they are real illnesses.
So these are real diseases, yes, affecting our brain, the
Yeah.
way we think, the way we see things, and
Yes.
that's why people are experiencing these things.
Yes.
There's no one who has bewitched them or cursed or demons.
No. They are real diseases, and the fact is that just try out seeking treatment. Someone who was not working, who was very untidy, who was keeping dirty things in their house, when they seek treatment, their life transforms, and it is quite encouraging even for us as healthcare workers. We are also quite encouraged because we see a real transformation. So we encourage you that don't hold on to stigma, because it makes the disease worsen. The more this person stays without treatment, the more the disease progresses, and it becomes hard to treat. So bring them to hospital, and you will see a very big change.
So thank you, Dr. Jeniffer, for the clarity you have brought to these issues around psychosis. Now, our viewers, Mathari Hospital, we are providing these services. Psychosis is treatable, and people recover fully and get back to their normal functioning. So thank you.